All right. We are going to move on just to our last session of the day. It is National Kidney Foundation programs. We're going to be hearing a little bit about their patient programs in transplant. Next slide. All right. So we have going to have three different people today presenting. Our first speaker is Catherine, and I'll get back to her. And you're going to be also hearing from two kidney transplant patient recipients in just a little bit. But I am going to introduce, Katey Cipriani. She is the patient programs manager on the National Kidney Foundation headquarters transplant program team. She primarily manages the NKF's Kidney Learning Center and the Big Ask, the Big Give Transplant Education Programs. So I am going to turn it over to you, Katey.
Hello. How is everyone today? Thank you so much for having me here. Can we go to the next slide, please?
Melissa, there you go.
There we go. Okay, perfect. And next slide. I, again, will be just talking about our patient programs in transplant. So just really quickly about the National Kidney Foundation. We are the largest, most comprehensive and long-standing organization dedicated to the awareness, prevention, and treatment of kidney disease in the United States. We take an activist approach to ensure better outcomes for the 37 million Americans impacted by kidney disease through diagnosis, treatment, and support. We are committed to expanding the cultural conversation from kidney disease to kidney health, and we educate the public on preventing kidney disease before it starts. Next slide, please. NKF has a full range of programs and services for kidney patients at all stages of disease, including early stage, those waiting for a transplant, transplant recipients, and dialysis patients. We also provide information for family, friends, and caregivers of kidney patients, people who may be at risk for kidney disease, living kidney donors, and those who may be considering living donation or becoming a living donor. We also provide information to the general public and healthcare professionals, including primary care physicians, nephrologists, advanced practitioners, nurses, and technicians, dietitians, social workers, and pharmacists. So we kind of run the gamut of providing education, as much education as we can to as many people as we can. Next slide, please. Okay, so NKF has a full suite of educational programs for patients seeking a transplant and for living donors who are considering donating. So on the left side of this slide, we have our transplant education, and then on the right side, we have our support services. So I'm just going to briefly touch on our transplant education and then kind of dive into our support services. So we have a full suite of programs. The first program that we have is our First Steps to Transplant program. And the goals of this program are how to connect patients with a transplant center and to begin the transplant evaluation, what to expect throughout the transplant evaluation process, and then how to get on the transplant wait list. Our second program, or really our first program, because this is the first one we launched, was our Finding a Living Donor program. And the goal of this program is to educate patients, whether in end-stage kidney disease or dialysis patients, on how to write and share their story to find a living donor. And then another goal of this program is that hopefully after going through this program, you will feel comfortable enough in sharing your story, and hopefully you'll receive a living donor transplant. Now, we do provide follow-up surveys for this program at 3, 6, 9, and 12-month periods, just to see if anyone who has attended this program has received a transplant, whether living donor or deceased. Our third program is Becoming a Living Donor. The goal of which is particularly geared towards people who are interested in learning more about the living donation process, but also people who want to be or are interested in becoming a living donor. So the goals of this program are how to connect with the transplant center, what to expect throughout the living donor evaluation, surgery, and life after donating, and then becoming, and hopefully people who attend this program will become a living donor and start that process to donate their kidney. And then our last program that we have is our after transplant program. This program primarily educates patients on what to expect after transplant and how to live well with their new kidney. So I'm going to mention this multiple times throughout this presentation, but each of these programs are available in multiple formats. The first way that you can receive this education is through live local events with your local National Kidney Foundation office. They can offer them in person or virtually. And then the second way is actually through our Kidney Learning Center, which I'll delve into more detail on a later slide. But this is a self-paced online learning center that covers all 4 of these programs. Next slide, please. Okay, so I'm going to delve into our support programs now. Next slide. Okay, the first program I want to talk about is our NKF Peers program. NKF Peers is a national telephone-based one-on-one peer mentoring program that connects kidney patients and people considering living donation with a trained peer mentor who have been there themselves. Peer mentors can share their experiences with dialysis, transplant, or living kidney donation with others that need it. This support program was launched in 2011. A few benefits of the program are that patients and donors feel socially and emotionally supported throughout this process. We've also heard that there's been an increased knowledge in the kidney disease state itself, but also more knowledge in going through this process. Participants have also mentioned that they feel more comfortable with problem-solving skills and self-efficacy, as well as improved outcomes and quality of life. So it's a really great program if you're just not sure where to go, or you need to talk to someone who has been in the same position. It's a really great program to be involved in. Next slide, please. Okay, so now I want to talk about our NKF Cares hotline. The CARES program's trained specialists provide a supportive and safe environment for patients, families, and the community to ask questions and receive accurate and up-to-date information in both English and Spanish. Patients and families who call or email the patient information hotline can receive free printed education materials mailed to their home. Common topics include CKD, all stages and conditions, GFR, creatinine, urinalysis, risk factors for kidney disease, treatment options for kidney failures, diet and nutrition information, living and deceased donation information, health insurance or financial assistance, patient and caregiver support, information on COVID-19 and kidney disease or transplant, and then end of life decisions. All of that can be covered. If you have questions, just feel free to either call the number here at the bottom or to email nkfcares@kidney.org. Next slide, please. Okay, so now I'm going to talk about our Patient Navigator program. The Patient Navigator program provides individualized one-on-one support to kidney patients getting evaluated for a transplant, or those who have already been evaluated for a transplant and are currently on the wait list to write and share their story to find a living kidney donor. Support is provided by trained transplant recipients, and you'll have scheduled phone calls or video calls with your navigator and mentor to just kind of help you through this process and talk through how to share your story, because we know it can be hard trying to figure out exactly what you want to say and what information to put in there. Next slide, please. Okay, so now I'm going to talk a little bit more about our transplant programs. Next slide. Okay, as I previously mentioned, NKF has a full suite of educational programs for patients seeking a transplant and for living donors who are considering donating. But we have 2 programs that focus primarily on finding a donor and another program that educates potential donors on what they can expect throughout the process. So again, our Finding a Living Donor program educates ESKD patients or dialysis patients on how to write and share their story to find a living donor with the goal of receiving a transplant. Throughout this program, we talk about different strategies on who to share your story with, who to start sharing your story with, what information to include, just different options that you can share, whether it's via social media or an email or through an alumni book or your fraternity, sorority, etc. There are lots of different ways to get started, and it's all about what's comfortable for you. So this program really just deep dives into that to just make you feel more comfortable about sharing your story, but also we invite family members and friends to come to this program as well, because we just have found that some patients may not feel super comfortable with sharing their story, but they are okay with other people sharing their story. So it's just a great way to kind of get started and, talk about living donation and talk about sharing your story. The next program that we have is our Becoming a Living Donor. Again, this one is particularly geared towards people interested in living donation or people interested in becoming a living donor. We talk about how to connect with the transplant center and knowing what to expect throughout the donation process, evaluation, surgery, and life after donating. Again, each of these programs are provided at local or can be provided at a local level with a local office, in person or virtually, and again on our Kidney Learning Center. Next slide, please. Okay, so at the end of our Finding a Living Donor program, and at the end of our Finding a Living Donor program, we ask all participants to complete a post-program evaluation, and just to see how we're doing, if the topics that we're covering are relevant, etc. And what our survey results have shown is that 100% of attendees who responded to our participant evaluation have rated the training as excellent or good. 100% of participants know more about living donation and transplant after these programs. 98% of participants said that they would recommend the training to others, and 83% plan to take action, either share their story on social media or with their friends and family or church or wherever it is that they feel most comfortable sharing this information. Again, on the slide, you'll see that these are offered live, virtual, or in person. And both of these programs, First Steps and Finding, can be offered in English and Spanish. Next slide, please. Okay, so on this page, I know that you see a lot of pictures, but these are all patients who attended a Finding a Living Donor programs and use the same strategies or tools taught in the program. One person in particular that I wanted to highlight is Gisela. She's right there in the center of the slide wearing the t-shirt that says contains recycled parts. She attended a Big Ask Big Give in the winter of 2018 as a participant, and in 2019 she was invited to be on the speaker panel because she used the strategies from the program and ended up having a living donor step forward and donate to her. And then one other story I wanted to highlight is Alan and Aisha. They are in the top left corner. Aisha's wearing a jean jacket. They actually found Alan's donor through a friend of a friend on Facebook. And Alan actually worked on helping us develop the Finding a Living Donor program several years ago at NKF. And while doing so, he ended up needing a kidney, and he had his wife Aisha become his advocate. So those are just two stories of people who have attended these programs, who have used these strategies that we discussed, who have helped them find a living donor. Next slide, please. Okay, so the next program I wanted to talk about is our Kidney Learning Center. In addition to having live local programs, the NKF also developed the Kidney Learning Center. This is an interactive, self-paced platform that increases access to education on kidney disease, dialysis, transplant, coping, living well with kidney disease, and living donation. The Kidney Learning Center offers online education in short interactive modules and is designed for kidney patients, families, care partners, living donors, and potential kidney donors. All of the videos that you will find on this platform are delivered by transplant recipients and living donors, and they also share their stories within the videos. The Kidney Learning Center includes our 2 signature programs, First Steps to Transplant and Finding a Living Donor, as well as our 2 newer programs, Becoming a Living Donor and After Transplants. All programs are available with English and Spanish closed captioning options. Next slide, please. Okay, so now I am briefly going to talk about just a couple other resources that we have that may be of interest to you all. Next slide. The first one is going to be NKF's online communities. The online communities offer a safe, supportive place where patients, caregivers, and living donors can share experiences, ask questions, and get answers related to kidney health, kidney disease, transplantation, and living donation. Participation is free and completely anonymous. All communities are monitored by NKF. We do know that sometimes patients have a hard time connecting with each other or finding someone who feels the same way that they do, or maybe experience something that they're experiencing. And so the online communities are such a great way to connect with people and to know that you're not alone in what you're feeling, you know, is normal. So they're just a really great resource if you're interested in joining any of those. And then the next thing is you can become an advocate. Your voice matters. By joining thousands of kidney patients, family members, and living donors, you'll have the chance to make a difference by helping to improve or change what's important in the lives of kidney patients and living donors nationwide. You can help by writing a letter to your congressperson or join a group on the local level to expand patient access to home dialysis. This will push to allow patients to make informed decisions along with their nephrologist on their preferred dialysis treatment option, to include being able to dialyze at home. You'll also be able to support the Living Donor Protection Act. This law protects living donors from being denied life, disability, or long-term care insurance after donating. So far, it hasn't reached all 50 states, but helping to support this law will protect all current and future living donors nationwide. And then the Kidney Advocacy Committee recently helped to pass legislation to extend Medicare's immunosuppressive drug coverage from 3 years to lifelong. By joining, you can help further other important laws and regulations. And you can visit advocacy.kidney.org to help make a difference. Next slide, please. Oh, next slide. Okay, so I know that I have covered a lot of information in a very short amount of time, and I probably talked fast too throughout that. But if you have any questions after the webinar today, you can find more information by visiting the websites below each resource, each program or resource, and I'll leave this up here for a couple of seconds so everyone can take pictures. Next. And then if we could just go to the next slide, because I want you guys to also take a picture of this last slide. This is my email address. If there are any questions that you guys have after this presentation, again, I know I probably talked very fast and there's a lot of information, but if you have questions, please feel free to reach out to me. That's what I'm here for. And if I don't have the answer for you, if I can't if I don't have the answer, I will get you in contact with the person who does have that answer for you. But I want to thank you all so much for inviting me and for letting me speak, and happy to answer any questions if we're doing Q&A at this time. I didn't know if that was now or later.
Yeah, thank you, Katey, for that, sharing of all that information there. Yes, I encourage everybody to drop any questions, or just, there was a couple comments coming in about this. Thank you for sharing. Didn't know there were these resources available, so thank you. What else did there was grateful that you have these methods for the patient advocacy available. Any other questions or just comments? A lot of thank yous, good information. Your website also offers kidney-friendly recipes. Someone dropped in there.
Yes.
Thank you for the reminder, of course. Yeah, and I think that's it. I enjoyed the presentation. Good.
Awesome.
Great. A lot of good feedback. So very good. Any other comments or questions for Katey? Okay. If not, Katey, you're more than welcome to stay on. We're going to talk to a patient kidney transplant recipient. So you're more than welcome to stay on if you have time.
Would love to. Thank you so much.
You're welcome. So as I has promised, now I do see Sarah. Is Darrell, have you joined the call? I don't see you.
Yes, I'm here.
You are? Oh, good. You're a call-in user?
Yes,
I'm
I
here
called in.
too.
Yes, ma'am.
Perfect. Well, great. Well, thank you. So as I promised at the beginning, before I introduce Katey, that we are going to have two kidney transplant recipients here with us, and we do. So I'd like to take this time and introduce them now. We have Sarah Ruiz. She is a two-time kidney transplant recipient. Her first kidney transplant was in February 1998 from her sister, and her second was in October of 2021 from a cadaver. She was on in-center dialysis for 7 years and was on the kidney transplant wait list for 7 years. We also have on the phone with us today is Darrell Guyton. He was diagnosed with chronic kidney disease in 2010 and started dialysis in 2017. He recently received a kidney transplant on June 15th, 2023. He states that receiving a kidney has been a blessing to him, and he encourages patients not to give up and encourages people to become active donors. So thank you, Sarah and Darrell, for being here today.
Thanks for having us.
I'm just going to start, I think, Darrell, I'm going to start with you with a question. Since you recently had a kidney transplant, can you tell us what your recovery was like after the transplant?
Yes, it's been a slow process, but at the same time, I've been gaining traction. There was having some trepidation at first because of the kidney that I received. It was from a person that was kind of slowly dying. It was taking a while for the program to get kind of active or where they wanted it to be. But at this point now, everything is starting to kind of stabilize and, and get acclimated to my system and my body. So I'm doing a lot better. My labs are looking great. I just did a biopsy this past Thursday, which everything came back negative. Just waiting on the full lab to return sometime this week. But overall, I'm feeling great. I haven't felt this well in many, many years. I guess, most people that know about dialysis and chronic kidney disease, how it can just wreck your body, mind, and spirit. So, but like I said, with this transplant, it's just been a blessing to not only me, but my family and friends as well. So overall, it's been a blessing, I said, and it's been great.
So Darrell, how many days were you in the hospital?
I was in the hospital 7 days, but I was recovering so fast at that time that the doctor was telling me, the nephrologist and the surgeon said I could have had left before then. I did all my physical, passing the test with the physical things. But like I said, I was in there 7 days, but it took me a while for my kidney to kind of get activated and start, passing urine. But eventually it started and everything went well. 7 days.
Good. Did you need any community assistance when you went home? So like anybody to help grocery shop, take your transportation to appointments or any other those type Meals on Wheels or home health after your transplant?
I didn't. Actually, my wife and I lived at I got my transplant at Emory Hospital in Atlanta. So they have like a Mason guest house for transplant recipients. So we lived there, and also with my wife's sister. She lived in the Atlanta area, her and her first cousin. So we had help from them as far as like getting food and the necessary supplies and things that we needed to and from the hospital for post transplant evaluations and labs. So I had a community of people that helped me, and also the social worker at the Emory Transplant Center was very well and great with her efforts to assist with resources for my wife and me. So it was a great overall. Everything was great. The medical staff was great at Emory. So yeah, everything went well as far as like getting the resources we need and getting to and from our transplant center.
Sounds wonderful. You were very fortunate.
Yes, it was a blessing. So we had already claimed that we was going to get the transplant. That's where we had the best overall experience before pre-transplant or whatever. So, and that's where we ended up getting the transplant. And I guess things worked full circle for us. And like I said, once we got into the hospital, the doctors and the nurses, the whole medical staff was very straightforward and gave us the information we needed in order to succeed. And they're still doing it to this day. So I commend them and all their efforts and the whole medical staff at Emory Transplant, because it was a wonderful experience.
Okay, great. Thank you. Sarah, I'm going to
You're welcome.
Yes. Thank
switch
you.
over to you. And I know you had your transplant 2 years ago, but can you tell us what your recovery was like after the transplant? Like how many days you were in the hospital, and did you and how long did it take before you started getting some energy and getting up a little bit after your transplant?
For my second transplant was a totally different experience than my first transplant. And because now my second transplant, 2021, I'm a lot older, and I felt it. But it was kind of sluggish. I spent 5 days in the hospital. During the surgery, I had a totally different experience than Darrell. During the surgery, they numbed my left leg. So when I woke up, I had no movement from my leg. So that kind of made me panic. And I actually didn't have any movement from that leg for months. So I was around, I needed a wheelchair to get around. I needed the walker to get around. It was tough. And, but little by little, I did some little physical therapy. My husband helped me out a lot. And I recovered from it. It still feels kind of numb. And it's 2 years, actually, this month. And the leg feels kind of like strange, but I can get around without the wheelchair and the walker and everything, and of course, the side effects, I feel it a little more from all the immunosuppressants, that I have to take every single day, as Darrell knows, right, Darrell?
Yes,
And,
yes, that's correct, yes.
We have to be very disciplined with those immunosuppressants. That's
Exactly.
the most important thing.
Yeah.
So yeah, that's been my experience, but I've had my husband and my 2 daughters helping me out, so I've been very lucky.
Yeah, definitely. It sounds like Sarah, you and Darrell both had some really good support systems, family, friends that helped you with the post-transplant process. And that is so important, I think.
Every transplant is very different.
Correct. Yeah.
Yes.
So, Sarah, were there any foods you had to avoid, or what type of dietary restrictions did you have? Whether they're, and I don't know if they've changed. So right after your transplant, what kind of dietary restrictions did you have, and now what do they look like now? Are you still same diet? Do you follow? Has it changed?
Pretty much. I've kept the same diet. In the beginning, it was tough because I was so trained in dialysis not to drink too much water, that when I got my transplant, I was like, I think I drank enough, and they're like, nope, you have to drink at least a gallon a day of water. So that was a big adjustment for me, drinking all the water, mentally you're like, okay, I didn't drink enough today, that kind of thing. And I also don't eat too much like high protein, because I think that's just, too much work for the new kidney, to process through the body and everything. But overall, I eat what I used to eat. It's not too bad. Grapefruit, I don't eat because that's not good with with the medications. So certain fruits like jackfruit and stuff like that, I avoid.
Right.
But overall, almost the same.
So we know that you had mentioned some of the immunosuppressant drugs that you're on and will be on, and we know that a lot of those tend to retain fluid or you gain weight. So were you given any tips to avoid that weight gain due to the medications?
Not really. I just when I was following up in the beginning of the transplant, I was really swollen. My feet were still swollen, kinda. So they gave me the medication to get rid of the water, and that helped out. But as far as, like I said, it's different. My first transplant, I didn't swell up at all. This transplant I did. So I took my pills for like maybe a week, 2 weeks, and it just started helping. And then now I don't take it. It's fine.
Mm-hmm.
Little by little, my body adjusted.
Yeah. Okay. Darrell, how about you? Did you have given any tips on maybe how to avoid the weight gain due to the medications?
Yeah, it's funny because like after I had the transplant, I started losing weight significantly. So and they had me on prednisone, steroids or whatever, but they was telling me to watch out for weight gain because of those particular supplements. But I actually, since the transplant, I've lost 60 pounds. And they don't really know the reason why. They ran different tests on it, but I guess it's in a good way. I was at 250, now I'm down to 190. So it's been a drastic change even with the medicine. So like I said, I've been having issues with like the immunosuppressants as far as like with reflux. It seems like I have something like GERD, but I don't think that's the issue. They're running some exams as far as like to see what's going on with my gastro system and to see if it's something that the medicine has caused some damage to that area. But as far as like gaining weight or anything, I never gained any weight. Actually, like I said, I've actually lost 60 pounds since June. So yeah, they say that's kind of different from what I guess prior recipients or most recipients they have had. So I guess I did something in an adverse or reverse manner. Yeah.
Yeah.
So yeah, it's kind of it's been a great experience. And then like I think it's about the only thing I really had. They had been checking for rejection, like minimal rejection, but like I said, all that came back clear because they seen like a fluid pocket on the side of the transplanted kidney. At first, when I first had it, they said it was some type of I was having a spasm on the surgery operating table with the kidney. The kidney had a spasm, and so they was kind of concerned that it was trying to reject at that moment. But like I said, they ran the proper tests and all, and yeah. And then like eating is why like foods I've had. I'm not really. I used to be a person that loved meat, but now I can't even really think about eating meat anymore. Just like my whole dietary plan has changed. I don't know if it has something to do with the kidney, but most of the time now I'm just eating vegetables and fruits and like Sarah was saying, I stay away from grapefruit and pomegranate type things because those are really bad for the transplant. So, but other than that, things are going well.
Great. Thank you. I know both of you mentioned you have had some really good family support and friends, but I wanted to know if you don't mind sharing, and either one of you I have this questions for, did you ever feel like you needed maybe some mental health support during the transplant or after the transplant? Were there times where you felt down, or did you seek out anything, or did your family?
Definitely, I did. Dialysis is hard, and it plays big in mentally and physically, and transplant isn't all easy either. I mean, it's better than being on dialysis, but also you sometimes feel like you need that extra, mental help and stuff like that. But like I said, my therapist and my rock was my husband. He was my therapist, and but I did need the help. And not gonna lie, sometimes I still feel like I do need the help because the immunosuppressants are tough. I have the same problem as Darrell. I have the gastro problem, and I believe it's the mycophenolate. I'm not a doctor, but I'm thinking that that's the one that messes around with the stomach. I'm gonna get that checked out. But and I see a question here. It says how long I had my kidney from my sister. I had my first kidney from my sister for 17 years.
Wow.
I kept, and this one is working on 2 years. So, Yeah, I've been dealing with this for 25 years.
Yeah, I've had some mental challenges as far as that too, as far as like with the transplant. A lot of things in the back of your mind, how long it's going to last, is just something, especially like when I had those issues where they were talking about I had mild rejection. I'm like, I just went through all this and was it for nothing? You know, you have those type of negative thoughts that creep into your mind, and you're like, okay, I don't want to go through this dialysis again. I just did this for 7 years, 3 days a week. You know, I was compliant, never missed a day, but I'm not looking forward to go right back on this again. So you have that, and then you're thinking about the person, like Sarah said about her husband. My wife was the same way. She was my rock, taking me to and from dialysis and also to the transplant, because I'm totally blind as well. So she's been my support person for more than just the transplant. So she's been everything to me to, you know, fill out paperwork, telling me where to go. So it's been a lot on her as well mentally. So I'm pretty sure during the transplant, she had to end up, you know, suspending her job. She had to drop out of nursing school to remediate for another semester. So, like, it's not only the transplant recipient, but the person or the people that are supporting you. They have mental, I won't say a breakdown, but mental issues as well, like especially with their finances, spiritual wise, and just overall the process. You know, it breaks and burns everyone out, because especially you're going to different transplant centers trying to get a transplant. Then that particular person can see what you're going through to try to get this transplant, and a lot of it probably affects them more than the actual person receiving the transplant through that whole process.
Definitely.
Thank you both for sharing that. You make some really good points. And again, you both are very blessed to have family and support you through this process, and still, but doesn't mean, you know, it wasn't hard, you know, so.
Yes.
Yeah. Sarah, there's a question in for you. I think I'm going to ask you right now. Was there a difference in the education or just overall experience from your first to your second transplant?
There are definitely a lot of differences between one and the other. Even like the immunosuppressants I took are totally different from what I'm taking now. It's amazing. And the surgery itself, also very different. When my sister donated, she had a pretty big surgical incision. Now it's so much easier. Here it says, my sister didn't have any adverse reactions. I'm just answering the question here. She did really well. And she had one child after, and it didn't affect her lifestyle. And she's doing very good after she donated to me. No problems whatsoever.
Yeah. Great. Well, there's a lot of nice comments in there, just thanking both of you for sharing your stories, your ups and downs. And this is true. We're not here just to talk about, you know, we want to be honest with everybody and talk about the, you know, your ups and downs that you went through. I think people need to know. So that's what we're here for today. So thank you for that, for sharing of that. So, great. So I want to ask, I guess I'll start with Sarah. What would you say to a patient that is thinking about a kidney transplant?
Like I said before, it's better than having dialysis. Dialysis for me was torture. And I did it 3 hours, 3 times a week, but it's so draining, and it's just, so transplant is a, you know, nice backup plan. Like, you know, it's good. It's good, but it's not easy either. You know, it's just a lot of side effects from all the medications, and you know, you do have to change your lifestyle, and you need a lot of support. But you have the freedom of traveling, and you know, sometimes eating stuff that you couldn't eat when you were on dialysis, and you know, freedom from dialysis. Yes. So you have to be a person that's very disciplined. You know, you can't say, oh, well, you know, this 15 pills this morning, I don't want to take them, or I'll take this later, or, you know, Those pills are very, 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 very important. And, you know, some people, I take 15 in the morning and 11 at night. And that's a whole lot of pills, but I know I have to do it. So you have to be pretty disciplined. This is serious, serious stuff.
Right.
But
Yes.
if you're like that, then go for it. Yes, definitely.
How about you, Darrell? What would you say to a patient that is thinking about a kidney transplant?
Like she was saying, like Sarah was saying, just you have to be very disciplined and notice what you want and understand that it's a process, and you need to be very compliant with dialysis, even though it's hard on your body and hard on your mind and the people around you. But if you're looking for a better outcome, which is a transplant, in my estimation, you need to be very compliant with the doctors, the nurses, and just be honest with yourself. Is this something for me? Because like it's a couple of people that I went to dialysis with, it wasn't for them because it is a long grind. I mean, it took me almost 7 years to get a transplant. I was on and off the wait list because of amputation to my toes. So, you know, anything that happened with open wounds, you have to report it back to the transplant centers, and you have to make sure that all those wounds are healed and you don't have anything going on outside of that. And just be positive. Stay positive is the main thing. Just stay positive and know that, you know, it's a better and a brighter day for you, because dealing with dialysis is a ton of weight on you every day, because thinking about the times after dialysis, you're very sick, your blood pressure is low, you don't want to eat most of the time, and then the days time to go back on a Wednesday, you're finally feeling better on Tuesday, now you have to start this process all over again. So that's the major reason why I got a transplant, and I wanted a different life and free my time up for my wife as well, because she's trying to work, take me to and from dialysis. It's just a lot on everybody. So, but if you want that transplant, you deserve it, and just do what you have to do in order to accomplish that goal. And just stay on and ask questions to any and everybody that you can ask. I mean, it can be the community, the doctors, the nurses, or somebody on the street, or you see somebody that's been there before. Open up to, hey, I'm thinking about doing getting a transplant. What do you recommend I do? Because that's what I've done. Like, I did a lot of research on my own, and the ins and outs, the ups and downs, the, you know, good and the bad about it, and, you know, what to look for and what not to, you know, what to do pre-transplant, during transplant, and post-transplant. So educate yourself. That's the main thing. Educate yourself. Talk to those around you that are professionals in the medical field, or just, you know, even talk to your pastor, those type of things, to get some insight, and then just stay close to your family. Make sure you have that support from your family and friends, because you're going to need that through this whole process. And just don't give up. That's what you want. You go get it because it's there, and just stay positive.
Thank you, Darrell. Appreciate that. And Sarah, I have another question for you.
Okay.
What is one thing you wish you would have had known about the post-transplant experience that you did not know before your transplant?
I'm gonna go to my first transplant. I had no idea that there were so much medications involved, visits to the transplant center. What happened? The side effects. Yes, my husband's helping me out here. The side effects of all these immunosuppressants. It's a lot of time and dedication, you know. It's a big undertake. Like I said, but it's worth it. But yeah, it's
Medications.
it's hard.
Yeah.
I was gonna say something else, but I forgot. I'll key it in if I remember.
That's right. I come back to you.
Yeah.
How about you, Darrell? What's one thing you wish you'd had known about the post-transplant experience that you did not know before the transplant?
Like Sarah was saying, it's just like the labs, and just, you know, the continuous involvement with the doctors, which is good. But, you know, all these labs are very significant, and, you know, you have to be on time for those labs. And also, like she said, taking your medication on a set time, because they want you to take them 12 hours apart. And you don't want to mess that time frame up at all, because any little offset of that time frame can mess up your whole process with the post-transplant as far as your medication. You don't want to take too much of, like you said, those cell and versus those type of immunosuppressants, because you take too many of those, they can cause a lot of stomach issues and overall health issues, even though they're there to, to help. And also one other thing that kind of was, I wish I'd have known, like with the cancer and all the different cancers that transplant can cause your body. And so you have to really stay up on those things as well with the cancers and, getting checked, colonoscopies and bone scans, those type of things. It's a lot. And those are the type of things that kind of are like, wow. When they told me that during when I was about to go into the operating room, the surgeon told me, did anybody tell you about the cancers, that the high risk of cancers from transplant? And, I had read about it, but I didn't know the significance of it until, they really explained it to me face to face. And it kind of got me off kilter or concerned at the time, but, I continued to go through it. But those are one of the things that I wish I'd known more about it before I went full-fledged with the transplant.
Yeah, good information. Good, very important. Thank you.
Yeah.
Sarah, did you remember your thought?
No, not yet. I'm thinking, no. I don't remember yet.
That's fine.
So I got it. Okay, I'm sorry.
go ahead.
I remember. Yeah. No, what I was gonna say is, it's a long journey. Going from dialysis to a transplant for me was 7 years. I waited for the kidney, and this is for people not to lose hope waiting, because in between that time, I had open heart surgery. And I was put on hold, of course, on the waiting list. And then I had lung surgery, which they took the lower left lobe. What else, Ed? My gallbladder removal, which is not such a big deal. But so I was put on hold while in the list, like 3 times. But I kept up with it. I kept calling them. Is it a year over? Is the year okay? Can I, put me back on? But just so that people know that they don't take you off completely. They kind of put you on hold, and they keep your time, which is important when you're on that list. You don't lose your time on that list. Like, you don't have to start over. So, but even with all that happened to me, and my autobody, my immune system, my antigens, they were like 99%. So they were pretty high. I had pretty low chance of getting a kidney because I had a previous transplant and I had 2 kids before. So, all that does that. But, and I still received one, so doesn't matter. Just don't lose hope. Stay on the list no matter what.
There's a comment for you, Sarah. It just says, Sarah, your answers about your sister has made me a little bit more comfortable to receive a living donor. So,
great. That's good.
That's absolutely
awesome.
Yep.
Yes.
Let's see. I'm just going to looking through the a lot of just comments from both of you on your stories, your journeys, and it says here. From a fellow patient says, you're correct, Darrell. I've been on dialysis for 16 years waiting for a transplant. So,
well, just keep the faith and, know your day is coming. Like, just stay compliant. Just try to do as best you can with your dialysis treatments, and like just stay focused and stay healthy.
Correct. Kayla says, I wish you would continue success with your kidneys. So very nice. Thank you. So, yeah. Okay, let me see. I think I'm caught up on the comments. Does anybody have any other questions, comments for Darrell or Sarah they would like to put in the chat?
There's one here about a psychologist. You had used any psychologist? I don't know about Darrell. I didn't use any psychologist. Not that I didn't need one, but I didn't.
I would agree with you. Yeah. now that I think about it, I wish I had. That would be something to add to that particular process. Yeah. So the things that you go through in order to get to where you are, yeah, that would be a major asset, for people in the future to actually add that particular medical professional to your team. Yes, I definitely would agree with that.
Yeah. Darrell, there was a kind of a question. Was the mentioning of the cancers mainly because you have a weak immune system?
Yes, that's correct. Yes, when you take those immunosuppressants, it leaves your body open or your system open to kind of catch anything more than just cancers. Like you're dealing with any type of infection. That's why they want you to stay isolated for at least 6 months, especially nowadays with COVID and stuff. You want to really isolate yourself. But the cancers, yes, that's a part of it. With the immunosuppressants, your body is open for any and every type of teratogen or type of infection or anything, because you're real vulnerable right after transplant for at least 6 months to a year. That's what they was telling me as far as like at Emory Hospital. So you really want to be careful and don't miss, once you get that transplant, don't miss any of those appointments, and make sure you keep up with those and get those done, because they're really important for not just your transplant, for your whole life in general, because it can affect any type of part of your body with those cancers.
Good. Good.
So you want to be real careful and make sure you keep up with your appointments.
It looks like there's a question. Again, thank you for sharing. Always brings things full circle. Best of luck to the both of you.
Thank you.
Definitely. A question came in. What would have motivated you to see a counselor?
Wow. I'm just learning to share my journey now. After my second transplant, because I've always been like shy, and I've always kept all my problems and my issues to myself. And what got me sharing my experiences now is I joined the PFAC with Yessi Network number 3, and that started having me speak up and become a mentor. I've mentored right now currently 3 people, and I'm helping them out, and I get the feedback, and it's awesome. So I should have done that sooner.
And it's so great to hear. That's awesome, Sarah.
Yeah, I was the same way. Like I was, especially when I lost my vision. It'll be 10 years in November of this year. I had lost my left eye in like 2008 from diabetes, but in 2013, I wasn't. I have any issues with my right eye, but I went to sleep and I had complete retinal detachment. Went to the doctor, but they couldn't do anything about it, and it's still like unexplained phenomenon to this point. What happened while I was asleep, and it kind of took a lot of my energy and like motivation away from life as far as like dealing with things. But actually, when I went on dialysis, it changed my whole view around about, like I'm thinking, why me, but not why not me? So, and that really gave me energy and support and motivation to say, things happen for a reason. And then like I'm here again, back, with another medical issue, but I'm not going to let it affect me the way it did the first time. So I got a lot of counseling from my wife. I mean, she's, like I said, been my rock. And, you need those type of people to help you when you're going through things, and especially things you can't do anything about as far like with your health. You need the support from your family and the doctors. And that has changed me to help other people. Like I help, I'm in with AAKP, Network 8. I deal with National Kidney Foundation. I deal with people that's African American or people of color dealing with diabetes and hypertension and kidney disease. That runs in my family. My mom had something called Gilman syndrome, which she was born with. Is an issue of the kidneys that caused you to eventually go on dialysis. And within the last 6 months, my father and my mother went on dialysis, and one of my sisters is potentially going on it soon. So I've been educating them a lot from the experiences that I've had, and it's really helped them out a lot. And so, I want to be an advocate for more people and let them understand that because you're going on dialysis or having chronic kidney disease is not the end. So just have to keep the faith and stay strong within your mind, and make sure you have a support team around you, and do what the doctor says, and take your medication, and keep the hope. Right.
Well, thank you both. I think we are coming to the time that we're wrapping up. Any last comment? Again, really good. Appreciate both of you sharing your stories about your transplant with us today. There's another way you are supporting people that are on the phone here and encouraging them, I hope, and go on and seek transplant if that's what they want. I think, you know, that they need to look into that. Hopefully you've given them a little more information and insight on what your experience is. And like Sarah, just exactly what you said, to transplant, they were two completely experiences. So everybody's different, but it just gives, I think, everybody on the phone today a little bit of insight. So thank you both for being here.
You're so welcome. I'm glad you all offer us to come on and speak, and I appreciate the opportunity.
Well, we really appreciate having both of you here too.
Same. Very happy to be sharing.
Well, great.